One of my favorite treatment modalities is platelet-rich plasma, PRP. It is a natural way for us to approach tissue repair, regeneration, and healing. We can apply it not just in aesthetics, but also in hair restoration, orthopedics, sports medicine, and wound care. It is used across the board to allow for us to treat patients with high yield and low risk. Let's get into it. Platelet-rich plasma is derived from a patient's own blood. We do a blood draw, we spin it in a special centrifuge, and from that centrifuge, we get a concentration of platelets. Those platelets are then injected to the part of the body that we are trying to treat. In aesthetics, it is used for facial rejuvenation. There's that famous picture of Kim Kardashian with blood all over her face. Now, the truth is you don't actually need to have blood all over your face to achieve facial rejuvenation, okay? But there is a modality where you can either take that PRP and inject it subdermally into the face, or you can microneedle it. So you apply it into the face, allowing for that PRP to be absorbed into the skin. What that PRP contains is cytokines, bioactive proteins, and growth factors that allow for cellular proliferation, collagen synthesis, and angiogenesis. The other modality that we use it in aesthetics is to treat scar tissue. So those of us who may have acne scarring, you can have it microneedled or injected into the acne scar, and through a series of treatments, you can have improvement of the appearance and sometimes complete resolution of those acne scars. And not just on acne scars, but you can actually utilize PRP to improve any kind of scar tissue, and it's been shown to help. Another favorite way that I like to use PRP is actually for under eye treatment. So a lot of times patients will come in complaining of darkening under the eyes or swelling under the eyes. And the best treatment that I find is really either microneedling or injecting PRP under the eye. And what that does is it allows for that PRP to improve that appearance of the skin and improve that hyperpigmentation under the skin without needing to use dermal filler, which generally I don't recommend. It's a very small percentage of patients that actually have benefit with hyaluronic acid dermal filler under the eyes. Whereas with PRP, it's a natural product. So the positive benefits come along with those platelets. There is improvement of the way those under eyes look. So a generally difficult area to treat, we have now found a way to be able to produce positive results for our patients that is, again, low risk, high reward. Now, the result of the PRP is not really the same as some of the other aesthetic treatments. Usually you do need to come in for several treatments before you sort of see that overall glow up. The recommendation is to sort of start with at least a 3-treatment series, at least 4 to 6 weeks apart, to get that overall facial rejuvenation. When it comes to scar tissue treatment, it really just depends on the severity of the scar, and that you sort of discuss with your patients, and that's a case-by-case basis. Now, with hair restoration, it's actually become a new tool that we have utilized. In hair restoration, it's a really great tool for a specific type of patient. I make this distinction, okay, because PRP is not a way to restore hair where it has now been gone completely. Meaning, if your scalp is bald and shiny, that hair's gone. PRP is not going to regrow it. It's not going to regenerate it. You need a hair transplant in that area. But if you have thinning of your hair, if you have mild to moderate male or female pattern baldness, right? So androgenic alopecia. If you have, let's say, postpartum hair loss, okay? If you have maybe issues with alopecia areata, we're starting to find some evidence that there are benefits with PRP treatment, though those treatments are a little bit unpredictable. But we are finding that those who are having thinning of the hair, that the way the PRP works is that it allows for stimulation of dormant hair follicles, it prolongs the hair growth cycle, and it increases the density and thickness of those hair follicles. This allows for a decrease in the need for a hair transplant, or at very least a prolonged period before you may eventually need a hair transplant. It's also a procedure that has essentially no downtime. You can go and get your PRP treatment and go about your business essentially right away. For those of you who have had a hair transplant, PRP is a great way to maintain those grafts. So PRP allows for angiogenesis, creation of new blood vessels in the area where it's injected. And by improving blood flow to those grafts, you maintain them and keep them nice and healthy, allowing you to essentially maintain your investment. If you combine PRP for hair restoration with other things like minoxidil use or finasteride use or dutasteride use, you're really giving yourself the best chances for prevention of hair loss. Now, the treatment protocol for PRP for hair is essentially one treatment every month for 3 months, one treatment every 3 months for the next 3 treatments, and then one treatment every 6 months moving forwards. Now, because this is an issue of hair loss, as we know, hair loss is a chronic issue, and the treatment for it needs to be continuous. Nothing in hair is permanent except for transplant. In orthopedics and sports medicine, PRP is used in conditions like osteoarthritis, tendinitis, ligament issues, or tendon tears. Now, it doesn't replace surgery, so it's really beneficial more in mild to moderate conditions. But what it does is it essentially decreases pain and inflammation, decreases the reliance on steroids and other pain medications like NSAIDs, so your Aleve, your ibuprofens, etc., and increases tissue repair and recovery. The frequency for this treatment is generally a series of 3 injections, approximately 2 to 4 weeks apart. In wound healing, so patients who have chronic ulcers, let's say from diabetes or from a poor vascular flow, PRP is also utilized to help regenerate the necessary tissue to cover those wounds, and it's been shown to be quite effective. These patients will need injections weekly or bi-weekly until the wound heals. Combining PRP treatment for wound healing with things like hyperbaric chamber have been shown to be very, very helpful. As you can see, PRP can be utilized for many different indications, but to appropriately get the right PRP treatment, you have to make sure that you're utilizing the appropriate PRP centrifuge. You see, if you take someone's blood and you spin it in a regular centrifuge, you may not get the appropriate amount of platelet concentrations in that sample. In order to derive optimal results, you need to get 5 to 7 times the concentration of the average patient's platelets in that sample. And in order to do that, you need an appropriate centrifuge that is likely a 2-spin centrifuge with a G-force of 200 to 400 that has tubes that are anticoagulated that can then produce the sample that you need. If you're using the PRP for orthopedics or wound healing, then you're going to need essentially a sample of PRP that is leukocyte rich, because some of that inflammation is going to be beneficial for you. If you're using it for aesthetic use, then you need PRP concentration that will be leukocyte poor, because you don't want that excess inflammation. So making sure that you as a provider have the appropriate centrifuge in order to attain the right amount of PRP is essential for appropriate treatment. Too little PRP in the sample is not going to benefit in any way. Too much PRP in the sample may actually have a paradoxical effect, and the excess inflammation may actually be damaging for the regenerative processes that we are looking for. So overall, PRP is generally moderately recommended in orthopedics and in wound healing as a treatment modality for patients, and is highly recommended both in aesthetics and in hair restoration. There is still copious research being done, and because of its high yield, low risk ratio, it is a beneficial treatment overall. for our patients. Let me know if there's anything else that you have questions on in the comment section below. Otherwise, like, share, and subscribe, and let's stay learning.